But let's focus back home now, and our top story that we are focusing on is the investigations that are still ongoing in as far as the babies who were placed in cardboard boxes, if you will recall, in May at the Mahikeng Provincial Hospital neonatal section last year. Of course, the department has released some findings, and they are currently looking at 3 or 5 officials who are nurses who are currently on suspension on more of their investigations. They've put their investigations on hold until next month. So NEHAWU has commented on these and, of course, accusing the Northwest Health Department of shifting blame for the babies that were placed in boxes to officials instead of looking at some of the inequalities or in fact, inefficiencies within the facility itself. For more on this story, let's now bring in a Democratic Nursing Organization of South Africa of the Northwest, Deputy Provincial Chairperson Mzwakhe Seleke. Mzwakhe, thank you so much for your patience. Let's now look at, and go back perhaps on this particular story. It did dominate headlines when it first broke out, last year, seeing those social media posts of babies wrapped in purple blankets and placed in those brown boxes. Let's start then by talking about what you know in as far as the findings of the investigations.
Yeah, thank you very much. Let me start by greeting the viewers at home and say that as far as the investigation is concerned, we were not given any formal report in terms of how far is the investigation and have they concluded or not. Honestly, that is what I can confirm.
During that time, it was initially reported that nurses were desperate and were running out of space, and that there was, long-standing issues of shortages of baby cribs at the facility. Do you think when you look at these investigations and the fact that 5 or so officials or nurses will be out of the job, depending on what the findings are, do you think the department is shifting the blame here?
Look, it is a culture in the Department of Health Northwest that issues, when they escalate, they want to use nurses as easy target. We want to also make an example of another hospital that is going through almost similar cases in Swaziland, where a psychiatric patient absconded, and then they are now going after the nurses there, which are junior nurses by nature, and they are trying to charge them. Even in Mahikeng Provincial Hospital, the same thing is happening. Due to lack of resources, due to lack of support by the department themselves, they want to shift the blame and say, despite the fact that they were up to their necks in terms of lack of resources, space, and support from management, they did what they could to make sure that they save those babies' lives and keep them warm. They are being victimized and being charged the way we see they are being charged.
Have there been any significant changes at that hospital in terms of, particularly as we speak about just the lack of resources and equipment? The Mahikeng Provincial Hospital's neonatal section, we heard some horror stories in terms of just what has been transpiring in as far as what nurses had to do just to compensate for some things that were not available.
Look, the report that we've got is that there is some movement, but the movement is very slow, because what we know is that the only thing that they moved with speed to replace are those actual cribs there. But in terms of human resource, they are still not up to the standard according to the South African Nursing Council. So the movement and the pace is very low, because for them to be, or those nurses to be able to offer comprehensive care in terms of nursing, they need not only the cribs, but also human resource support, because there is a certain ratio that is accepted by a statutory body to say a nurse can nurse a certain number of babies. As things stand, the situation still persists, and we will not be surprised if another horror happens there.
In terms of just the reporting lines, in an issue or in a situation where, there is an emergency, some of the things that came out during, that exposure of the babies being in boxes was that the department said that nobody raised the alarm in as far as the shortage is concerned. But in as far as that, when you look back to that, those moments, what can you say about that? I find it very difficult to understand why that issue was not raised beforehand.
Look, that is a pure lie. We are in possession of minutes of management meetings. We know for a fact that managers of that unit were called on the said day. So in those minutes, they continuously plan to improve that situation. But there was no improvement that was actually implemented. Until that expose, that is when people started running around to see how they can solve those issues. But our view is that in this province, nurses are seen as soft targets, and as DENOSA, we will not allow that as a union. We will forever stand and defend the nurses of this province.
One of the things that incident highlighted, and many other incidents highlight, is of course the shortages within hospitals in as far as resources are concerned, but a number of other things, even how patients have been treated. And I want to talk about that. We have seen a number of social media posts even in recent times, which go viral around the lack of care by some nurses and doctors at public health facilities. As DENOSA, I hear what you're saying in terms of defending nurses at all costs, but what do you say about those reports from the community members around these hospitals who are complaining about the fact that they are being ill-treated at these hospitals?
Look, we can't condone any abuse of the community, honestly. We can't condone that at all. But what we are saying is that in a situation where a nurse is given the full support, is given the full resources to do their work, the working environment is conducive for them to render a proper and good nursing care, we will definitely make sure that we call good where is good and bad where is bad. That is the honest truth. But we will not stand by and allow any nurse or any employed nurse in this province to be abused. Like I made an example when I started to speak, to say, in Zanele Hospital, nurses are being charged there for system failures. The same applies to Mzwakhe Provincial Hospital. Those are pure system failures, where administration failed to support the nurses there with tools of trade. Because to nursing, having a proper crib is a tool of trade. Having a machine to be able to take BPs with is a tool of trade. So on those areas and in those situations, we will never be able to fold our arms and say we will not be able to stand for our nurses. Definitely we will be there and we will stand for them.
Mzwakhe, thank you so much for your time. Let's leave it there for now. Mzwakhe Seleke is the Deputy Provincial Chairperson of DENOSA.